morning. My name's Dennis. I'll be keynote speaker for today. And the thing I would share with you is that if you have individuals that are currently not members of this association, I've been a member of my state association since 1979. That's the year I graduated from my nursing program. My faculty told me if you're going to be a professional nurse, you need to be a member of a professional nursing organization. So I'm good at doing what I'm told. So I've been a member for many years. The other thing I'm going to share with you is that you're going to hear some southern drawl for the next hour. I was up in, I think it was Cape Cod, working with some nurse execs. And actually reminded me last night when I was walking by the beautiful boardwalk last night, I was looking out at ocean waves, but she was looking at ocean waves that morning and they were just kind of coming up and just kind of slapping up on the shore. She said, you know, up in Boston, we have accents too, you know, we pop the cause. She says, but our accents up here up north, she said, they're just kind of short and abrupt. She says, but down south, she says, your accents are like the water that slowly moves down the stream. So colleagues, I will try to be a little more, I will try to speed up my talk today. So we got a lot of content to cover in this hour. I want to share with you that we're going to talk about creating healthy nurse workplaces. And part of that, you already heard Catherine say, and you heard Ben say about this kaleidoscope of nurses. And that's one of the great powers that we have is there's so much diversity within our nursing workforce. And that this creating a healthy nurse workplace is all about our choice, whether we choose to make it better. Now, I don't know if I'll have a cough today, but if I did have a cough, one of you would either come up and pour me a glass of water, or somebody would start a cough drop from the very back and you'd pass it across. That's what nurses do, don't we? But what we want to start thinking about is while we're always looking after each other, we've got to look after ourselves. We've got to also look at how we can improve our workplace so that it engages us as nurses and provides better patient care for our patients. So part of that is all about attitude. Would you agree? So I've had days when my patients, when I think about what I'm thankful for, that I'm thankful that I'm awake. Right? Because I've had patients sometimes that didn't make it through, didn't wake up in the morning. I've had days that I'm thankful that I'm alive. Because I've had days that I've had patients that didn't make it through the evening. And I will tell you another thing I'm thankful for. I'm thankful that I'm a registered nurse. I cannot tell you that I've been in this career for over 38 years now, and there's not been a day that I regretted to become a nurse. So, if you'll all stand, please, what we're going to do is we're going to do a cheer. And you're going to have to uncross those arms. Because I come from Winston-Salem, and Winston-Salem is about where the Bible Belt begins. Okay? So when I say I'm awake, you're going to say, I'm awake. And when I say I'm alive, you're going to say, I'm alive. And when I say it's great to be in nursing, you're going to say, it's great to be in nursing. Now, I understand we're on, what floor are we on? Sixth floor. There's a casino down in the second floor, I believe. I want them to hear what's going on up here. And say, what are those nurses, what are those crazy nurses doing up there today? Are you ready? Yes. No, you don't sound ready. Are you ready? Yes. I'm awake! I'm awake! Wait. Everybody get their arms up. Everybody's got that? Okay, if you're filming, you don't have to put your arms up. Just one of them. All right? You ready? Still don't sound ready. Are you ready? Yes. I'm awake! I'm awake! I'm alive! It's great to be in nursing! Just give yourself a round of applause and have a seat. I will tell you, I love nursing. There's never been a day I've regretted it. And I will also tell you that the evidence shows a supportive work environment is going to allow nurses to give better patient care. And I've always been a believer, if you look after nurses, they're going to look after the patients. You know, remove all these barriers that limit them from being in the patient's room, in the patient's home, and providing quality patient care. The data's there. I don't have to read it for you. They have these handouts, right? They're accessible to where you can pull this down. So they'll be available. So you don't have to take any notes. Just listen. enjoy this session and think through, because I'm going to ask you to consider a couple of things. You don't look so good. Should I call the nurse? And she says, I am the nurse. Now, when you're thinking about, the reason I brought this cartoon is that when you're thinking about quality workplaces, of course, we want our quality workplace at the very basic to provide patient safety. And we want that quality workplace to provide quality care. But also, that's in the bed on the left. But in the bed on the right is a nurse. And we also want that healthy workplace to provide a healthy and engaging environment for that nurse. And I think that requires two things from us as nurses. One, it requires a personal commitment, a personal choice, which you mentioned a while ago. That we have to decide we're going to care for ourselves. And I've always been a believer that if you recharge your batteries, you find the ways to recharge your batteries, then you're going to be much more able to be fully engaged when you go to work. One of the things I've always loved about nursing, I've been married now for 38 years. People would say, my wife would say, did you think about me today? I said, baby, no, I did not. Because when you work a shift in nursing, you step on that unit, where is your mind? It's on problem solving, it's on priority setting, it's on what's next. If all heck is breaking loose. And that's one of the things I've always loved about it. Because you have to be fully engaged. And the other thing is to make a choice to be fully engaged in your workplace. How are you making it better? How are you improving the policies? How are you making it a place, a culture that where you want to be? So that's when I think about the bed on the left and the bed on the right. By and far, hospitals still require the largest number of nurses. Now we now have a higher proportion of nurses working in outpatient settings than in hospitals. But hospitals still continue to be the largest employer of nurses. But realize the hospital is one of the most dangerous places to work as far as an illness or injury that will cause you to take a sick day. It's more dangerous than manufacturing. It's more dangerous than construction. Causes of injury are not going to be surprising. Overexertion, bodily reaction, moving patients, we know is still a big issue. Slips, trips, and falls. Violence and other injuries by persons. Now, animals, I'm going to think they included that like for probably the veterinarians in this survey. This is the OSHA survey, so I don't know that animals have ever been a big injury, for nurses.
Home care. Home care they are.
Home care they are?
Sure.
Okay. Well, maybe they put this in for the home care nurses then. This data is for hospitals. Contact with objects or equipment, exposure to substance. Colleagues, this is not anything new for you. You get an idea. You know what causes the injuries. You've lived it. Now, you mentioned the Healthy Nurse, Healthy Nation. ANA has moved forward with this initiative, asking individuals to choose to make your decision for yourself, whether you want to participate in this program or you're looking at ways to improve your health. I'm a walker. I love to do my 2 miles every morning. And I found as an active addition, I've got to do that. If I don't, I just get bigger, 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 bigger. I know I need to walk some more miles. But what they said, their definition, they said healthy nurses are someone who actively focus on creating a synergy of physical, intellectual, emotional, social, spiritual, personal, and professional well-being. It's not any different than when I did my nursing program. It was looking at the biopsychosocial, cultural, and spiritual needs, right? We all learned that in our nursing programs. But it is about all of you. And how does your workplace, how does your individual work improvement as far as your own health, but also how can a workplace do that? How does it engage in being a part of it? The ANA did a study back in 2014 that looked at the risks and what were the major injuries. The biggest safety risks were workplace stress. Once again, what we do, You can't just set it to the side and go down and take a break for 15 minutes and not be concerned about what's going on while you're not there. Lift and repositioning heavy objects, prolonged standing, needle sticks, bloodborne pathogens, infectious disease agents. Once again, I don't think it's anything that surprises anyone, but just realize there's stressors out there. Top health and safety risks, 60% reported that they do work through their breaks, coming in early, or stay late and accomplish work. 50% reported unusual shifts that were working 10 hours or more. 50% have been bullied. 25% have been assaulted at work. 10% reported they were concerned about their physical safety. So as we're going through this session this morning, think about those pieces and think about what would need to occur at your workplace to address some of that. As far as work site wellness, they found that 90% reported their place of employment was tobacco-free. Colleagues, I'm from North Carolina. I grew up on a tobacco farm. I cropped tobacco as a young man. But I will tell you, my father never wanted us to use tobacco, but he still grew tobacco because that's what he knew to do, to put food on the table. So yeah, I'm a big proponent. We don't need to have tobacco. And tobacco-free, we've really made great strides as a nation to try to move towards tobacco-free. And we know we've done that. It's amazing now, even when you smell a cigarette, used to go around them all the time, and now you do realize, the odor that they bring in, those kind of things, and the hazards. 70% had access to worksite wellness programs and promotion programs. 60% indicated they had access to healthy foods such as fruits, vegetables, whole grains during their work hours. Now, so we got to be thinking when we make that personal choice. Those patients bring those donuts and set them on the unit. Or if they have those bananas sitting around, what's the healthy choice? We've got to make that decision on who we want to be and where we want to go with our health. And think about for ourselves, what kinds of things can improve our health? Well, we know to exercise at least 30 minutes, 4 to 5 times weekly. Now, some of you will say, well, I exercise, I walk all day, but does that give you the cardio that you need? You've got to decide for that. But that's your choice. So that's what we need to look at. Know your family history. If there's anything we need to look back and look at what our major issues are within our families. We know sometimes looking at genetics, to do some genetic studies to see what issues are going on. Make sure we eat fruits and vegetables, fewer processed foods, reducing stress, regular checkups, screenings, immunizations. Everybody had your flu shot yet? Good for you. I'm getting mine Friday, I think. And be thinking about this being a healthy workplace champion. I know you're saying that, Sherrod, you're asking me to do one more thing. You're asking me to look at one more thing. But what I have found sometimes about nurses is that I think we attract people into nursing. I don't have any research on this, but I'll tell you, I've lived it for many years. I think we attract people into nursing many times that are willing to give much of themselves away to others in providing patient care. And I will tell you, you've got to save some for yourself. And you've got to set some aside for your colleagues. Once again, if you have a work culture, I have studied this, if you have a work culture that engages individuals, then it does provide better patient care. We've seen the evidence shows that you have correct workloads, that you have correct shifts that allow you to be fully, that allow you to be able to drive home safely and not nodding as you're going home. Those are important pieces, and those are something you need to bring to the table. Now, the other thing you will notice throughout this presentation, as a matter of fact, in the beginning, when we talked about doing this presentation, I think the first title for this was Creating a Healthy Workplace for Nurses. And then I actually emailed back, and I said, no, let's change the title. We're not creating this for nurses. Because colleagues, you need to understand, ain't nobody gonna do this for you. Okay? We as nurses, you will see throughout this presentation we're talking about leaders. And I know that people that attend these conferences are leaders. So I know you're leaders in your organization, you're leaders on your units, you're leaders in your agencies. So realize you don't have to do it all at one time. Who knows how to eat an elephant? You eat that bad boy one bite at a time. Right? So, and, you know, most of what I study is retention. You know, what kind of workplaces retain nurses? And it's workplaces that have multiple facets in there. There's no magic bullet on one. There's no one thing that's going to make a work culture be engaging, that's going to make you, you know, make everyone want to stay there. So it has to be a number of different areas. But one of these pieces is the stress. Well, a colleague and I, you may not be aware, I serve on editorial board for Nursing Management Journal. I would encourage you, if any of you have ideas that you'd like to write, please let us know. We would love for you to write an article about what's going on in your organization. But I did this article a couple of years ago. It was just selected. I think it's going to be distributed to reprinted, and just reprinted in the Journal of Nursing Management. I think Journal of Nursing Management, I believe. It's coming out in a supplement there. It's going to be distributed at the Magnet Conference this summer. But we talked about addressing stress. I think it was called Mental Health for Nurse Managers, mental health tips. But one of those ways of dealing with stress is to strengthen your hardiness factor. There's been a lot of studies done on hardiness in nurses. And that hardiness is all about, rather than trying to avoid conflict, rather than trying to avoid the stress, realizing that looking at how you can be committed to addressing it. How can you be committed to dealing with that? And I can think about that personally. I've had some people sometimes I've interacted with, and sometimes I prefer to avoid that conflict. And I think about it for a while. I said, nope, I just need to go ahead and address this. I need to have a conversation. I don't need to do it in front of an entire group, but I need to bring it over to the side and let's have a discussion. But having a commitment, and then having how you can control it, how you can see it as a challenge that you can address, and how you can improve that. The other one is boosting emotional intelligence. And much of that is all about knowing who you are. And it's about self-awareness. What ticks you off? What are the things that get you? I will tell you, when I was working shifts and I would come in and my med drawer was halfway empty when I started my shift, that just ticked me off. Because I will tell you, Sherrod likes things in their place. I do. I can deal with them out, but I really like them in their place. But you got to be aware of what sets you off. Now, I will share this with you because all of you are nurses. Everybody's nurses in here, right? Because if you're not a nurse, I can't talk about this. You know, for a nurse, some nurses it's vomit. Some it's sputum. Oh, you're videotaping this too much. Some there's other things that just kind of get to you, you know, and some doesn't bother you. You know, some doesn't bother you at all, but sometimes they do. So know what they are. Know what sets you off. Know what those issues are, so when you see them coming, you can understand this is how I need to, and you're thinking through how you're going to address that, how you're going to manage whatever you're dealing with. And be aware of social awareness. What are the connections of colleagues around you? And make sure you have supportive relationships. Make sure you have someone that you can is always going to build you up and not tear you down. I've told people this for a long time. You take your breaks, don't be taking your break with that whiner. You know what happens when you start whining, right? It's like a cyclone. Yeah, I'll go ahead and call it. It's called a bitch and moan cyclone. Okay? It sure is bad around here, isn't it? Isn't it bad here? It's terrible, isn't it? It's bad.
It's horrible.
It's horrible. Don't you think it's bad too?
Absolutely.
Look, it starts like this. Boom, it gets bigger and bigger and bigger. We just all get sucked into it. You know what? All it takes is one person to say, you know, it's really not that bad.
Never want to kill that person.
Times are tough right now. You know, there's some challenges ahead of us right now, but it's not all that bad. We just got to be aware. Here's some things we might consider to put in place to deal with that. So be careful about that whine and cyclone, because it can pull us in. Think about how, and work with people that are going to support you. Work people that know where your warts are, but still love you anyway. And they will still support you anyway. Those are the people, when you're dealing with how you're going to deal with this issue, that you can have that conversation. Remember, Ben, when you talk for a few minutes. Here's what just happened. I need to have an idea. You can do your thing now. I'm just using your names. I have a brother named Ben, by the way. Excellent. So you can have that quick conversation before you react. Because sometimes that initial reaction might not be the best place you need to go. And that's one thing with emotional intelligence, with emotional intelligence is helpful. Appraise and limit engagement. There's been times in my life I've had to cut some things out. Sometimes as a nurse, we have this basket. We go around and say, oh, you got something else for me to do? Oh, put it in my basket. You got a bad issue? Put it in my basket. You need some help too? Let me spend some time with you. Okay? And you've got to be aware. I have this conversation where I'm teaching, I teach graduate courses right now. But I will tell you, I have this conversation with my students every semester when they come in as a new cohort. That you need to talk to your kids. You need to talk to your significant other. You need to help them understand that home-cooked meals might be out of the world for a while. Unless your significant other can cook. Because this program is going to consume you for at least 2 years if you're going full-time. Okay? So sometimes there's things you need to kind of realize. You need to appraise and limit your engagement. Sometimes that can be with your kids. Sometimes it can be with your significant other. And sometimes it can even be at work. If somebody asks you, we've got this new service line we need, and I know you're just the person to do that. You need to be thoughtful and give it some thought. You don't have to immediately say yes. You can think about it and say, well, let me give that some thought. And actually, the thought you give it thinking is how you're going to say no. Right? That's all you have to do. Say, I need to give that some thought. I'll get back to you in the next couple of days. And you may already know you're not going to do it, or you don't want to do it. And you can be thinking about, what's the rationale for saying no? You can go ahead and build your case. You don't have to do it right on the spot, okay? So be aware of that. Emotional intelligence can help you with that. Clarify competing priorities. Know the values, know what your values are, and stick to those values. If it helps address values of where you want, and those values, can have different portions in different parts of your career. I tell people when you're doing retention, if you want to look at retainable moments with nurses, you got to know where they are in their career. There was a time in my career, if we did something that helped me spend time with my wife, that was going to be where I was. But right now I have 3 beautiful granddaughters, a grandson. They're 4, 3, 2, and about 1. So if you want me now, find some way for me. If you want me to do something next year, you show me how it's going to help me benefit my grandkids probably. So know where you are, know where your colleagues are, and know where you are as far as clarifying your competing priorities. And as far as what you will agree to, what you're not going to agree to. Personal safety. There is new technology out there that's being developed that you may want to look at staying up on that kind of technology, decide, does this need to be placed in your organization? We know that one of the great things I think about conferences is coming and getting updated on the latest technologies so you can decide that whether you need to take those back or make some suggestions. One of the things that's being worked on is new material for scrubs. It's fluid repellent and antimicrobial. You know as well as I do, a lot of scrubs, a lot of materials we wear, those solutions I talked about a while ago, those body fluids I talked about a while ago, when they get on us, they do what? They seep right on through to the skin, don't they? So this new technology is fluid repellent and it's antimicrobial, so it'll help prevent any kind of, and scrubs are being made. The question's going to be, what's it going to cost? And I know for you it's going to be, what colors does it come in? Oh, that's going to be important. Better security, and it's terrible to have to talk about this, but do we need metal detectors? I know some ERs probably already have metal detectors in them. Some of the other agencies, do we need to have a database that's flagging belligerent or aggressive patients? And when we get to the point that we're able to have a right to say if you care for a patient or you don't care for a patient, go ahead and make sure you've got those policies in place if you know that's an issue along the way. Bulletproof glass, if that's needed in some of the ERs. We know this is always a big issue, appropriate staffing, making sure that you've got the nurses needed to provide for the care, and that will continue to always be a challenge. I still haven't seen a acuity system that meets all the needs of the change of care, changes that can occur within a shift. Being a part of a surveillance system, I didn't attend the session last night, but you guys may have talked about this with the being the IPINA, International Safety Centers exposure. So and prevention programs. So if there anybody anywhere that's part of this, if there is an exposure of some type of infectious disease or whatever, it can be reported immediately. It hopefully can be reported internationally, not just nationally, but internationally. The World Health Organization has, since 2010, they've made a policy on healthy workplaces. They said you need leadership, commitment, and engagement. Now, once again, when I talk about leadership, please understand, it doesn't say administration. It says leadership. And in your organization, there are formal leaders. Many times that's administrators. There are informal leaders, and I would bet if I was walking into your area, I would guess that's probably you are one of those. And you would know who those informal leaders are. And that's always an important piece of when you're looking at making change or implementing change, is knowing who the informal leaders are and what is the strategy you can put in place to help put some of these ideas to make them occur. They said we need employee engagement. And we've got to have business ethics, and it's got to be legal. It's got to be a systematic, comprehensive process to ensure effectiveness and continuous improvement. So one of the things you may consider, many of you now, based on the magnet model, many of you have a patient care improvement council. You may either make a part of that a healthy workplace as a part of that. You may go back and say, look, I heard this crazy guy. He had a real heavy-duty Southern drawl. He was a crazy guy that suggested we begin talking about how do we make our workplace healthier as part of this council. And they're going to tell you immediately, oh, this says right here, the focus of this council is to improve patient care. And you can say, I've got evidence right here that shows that if we improve the workplace for nurses, it improves patient care. So that's the rationale you can use when you share that. When you're asking for anything in your organization, I don't care if you're asking for a month off paid, you couch it in one of three ways. Either how could it improve the quality of patient care? How can it improve access? How is it going to decrease costs? Choose one of those three. Now, you don't have to write those down, but stick those in your mind somewhere, because when you ask for that month off, if you can show that you being, well, that might be a concern, if you being away for a month improves quality of patient care. But you get mine, and you understand what I'm saying. One of those three options is usually what you're going to do to demonstrate why this should happen. And it's got to be sustainable, it's got to be integrated, so it's got to be throughout the organization. We know that the American Association of Critical Care Nurses for some time now, they've actually done this. I know I was been talking about some of this stuff at least 10 years ago, so I know they've been discussing this for 10 years. And they said what needs to happen is skilled communication. And we know that many of the studies have shown that the biggest reason for errors in patient and health care is communication issues. So that might be an area that you may want to focus on, that you may choose to look at how you're communicating, how communication occurs in your organization. Or it may be collaboration. That might be the area that you think has the biggest need, is how are you collaborating with nurse to nurse, or from nurse one shift, from night nurses to day nurses, or from nurses to physicians, or nurses to whoever. Once again, effective decision making, appropriate staffing stands there. It's huge as a part of that. Meaningful recognition is a part, and authentic leadership. Authentic leadership is all about being who you are. And I will tell you, in all my years, I will go ahead and tell you this secret. I don't tell a lot of people this. There was a time in my career I went to a speech therapist with this Southern drawl. You know, because it doesn't make you sound smart, right? Come on now. You guys up north, y'all know if we got that Southern drawl, he ain't really bright as tool in the shed, right? So I went to a speech therapist. This was early in my career, you know, to try to, because my students used to come down when I first began teaching. My students from somewhere up in, we had a lot of students from up north. They'd come and say, Mr. Sherrod, when you say light, bright, and bright, you know, I do a little bit better with light, bright, and bright. Used to it was light, bright, and bright. So I had a colleague one time, he told me, he was from up in Roanoke Rapids, which is not far from where I was in eastern North Carolina. He said, Dennis, I went through that too. He says, you know, but what I decided, he says, you know, it's always good for people to not really think you're smart as you really are. You keep a little in reserve, right? So I decided I was okay with that. But as I said, as I've traveled the nation in different places, it has been interesting to, see how, and I found that people like it, they enjoy it, So I've decided I'm going to go with it. But that's who I am. And that's what the reason I share that with you is, colleagues, you need to be who you are. Wherever you're from, if you're from a rural area, if you're from inner city, when you hit that workplace, you need to bring it all with you. And just like you said with the kaleidoscope, if you're from African American descent, if you're from Asian descent, if you're from European descent, when you hit that workplace, you need to bring it all with you. Because that's one of the things that makes it great. Because if I want you to be just like me, and you become just like me, then one of us is redundant. Right? We don't need two of me. We need the power that diversity brings in the workplace. So be aware, meaningful recognition and be who you are as far as authentic leadership. Now, Shirley has just done a study, well, that's just published in 2017. It was a systematic analysis. And with a systematic analysis, they review all the research that's out there currently, and they did this review on creating sustaining healthy work environments. Didn't surprise me what they found. They found got to have quality leadership. Got to have relational exchanges is an important piece. I'm sorry, quality, got the attributes and the style. Hey, there's emotional intelligence, right? Leadership competence, vision, advocacy, and messaging. We're going to talk a little bit more about it in a moment. And with that, it's all about where you're going. You can go around instead of doing that whining, you can begin thinking, hey, you might go to a staff meeting, next staff meeting, you said, one of the issues that I saw, that I walked away from the conference was that we need to be thinking about a healthy workplace. Can we consider that? And it might be discounted the first time. Bring it back again. Think about your message. Think about low-hanging fruit. What can be done first to put that in place? And then when that happens, then you can say, look how successful this was. Everybody likes it. Let me tell you why this can be a challenge sometimes. I had a hospital in North Carolina that called me and it says, Dennis, can you come and do a presentation on the advantage of self-scheduling for nurses? They said, we've tried to institute self-scheduling here. You know what our nurses are saying? They're just asking us to do one more thing now. They want us to do the schedule and not pay us for doing it. Come on, guys. Right? They brought in, it was called the SS governance. They put a big chip on the wall. They brought palm trees. They were paper palm trees, but they brought real sand in that building. It was like a beach. And they said, we're going on this cruise. The SS shared governance and talked about the value. Well, once they started self-scheduling, they would never turn it loose now. Because once again, it's within your control. You hopefully get this, there's some parameters of what they've got to do. But once again, I tell people, if you've never seen over a fence, you don't know what's over there, right? So help your colleagues. Help them know that there's some possibilities over there, that there are possibilities for a healthy workplace. Here's some suggestions. Here's some things we need to think about. But you do sometimes have to help your colleagues peek over the fence. Relational exchanges, leader-member engagement, communication, collaboration. Hey, are you beginning to see some trends? Relational exchanges, shared decision-making, respect and consideration, environmental elements, where some structures have to be supported. You got to have access to resources. You got to have developmental opportunities. All those are important. They're important pieces. So engaged nurses achieve better outcomes. Have you ever had a day that you go to work and you hope that when you drive it in there, however you drive or however you get there, you're kind of thinking about what's got to be accomplished that day. Correct? I mean, that's what you're doing, right? Most of the time, what's going to happen today. So you hope that each day you can, just like this coloring book, you can meet the basics, right? Isn't that what you're going to do? You got your plan. You're going to meet the basics. So you plan to meet those basics. And have you ever get there and you didn't get anything done that you wanted to do? Anybody had a bad day lately? Who's had a bad day? Raise your hand. Slap that bad day right there. Oh yeah, it was a bad day. You have a bad day? It's when you think you're going to get there and get something done and you actually don't get anything done at all. I'm sorry, colleagues. Usually when I do magic in North Carolina, I get applause when I do this kind of thing. I thought y'all were going to be an easy crowd, but I see you're tough. Now, sometimes that bad day, some people start looking on the work schedule. I see Sandra's working today. That's going to be a bad day. Come on, colleagues.
Where?
Come on, colleagues. Have you not done that before? Okay, my question is, why are you not talking to Sandra? Once again, this is all about us, our decisions. I don't mean to put you on the spot. You can say the same thing about Dennis.
It's true.
Has anyone had a great day lately? In work? Will you slap that great day right on you? Slap. Tell me how good it was. Oh, that's a double slap. Anybody else have a great day? Great day.
Great day.
Colleagues, when you have a day that does more than you ever dreamed it could do. You didn't know you get magic this morning, did you? You might have a comedian to finish the thing, but you got a magician to get started. So, what caused those great days? What was it about those great days? All came together? Now, I've also seen nurses look at schedules and say, all hell could break loose today. This is going to be a good day. Why is that? Positive attitude, self-motivation, chipping in, helping each other, teamwork. What else? I'm sorry. I heard some kind of thinking. Thinking positively, okay. All those are important. But yeah, I've looked at it myself. No matter what happens that day, that's going to be a good day. And I've also seen it. Oh, so-and-so's working today. That's probably not going to be a good day. Now, if that's so-and-so, the question is, A, can they be improved? Are you addressing, and I don't mean you put the nurse manager on, but how are you as a colleague working with them? Maybe having a conversation with them, how they can be improved. And if it can't be improved, kick them to the curb. They need to move on. Because sometimes dead wood is not going to help have an engaged environment. It's not going to have a healthy workplace environment. Just like when nurses are hired, colleagues should be a part of that hiring process. So you can have a say that this is going to be a good fit, or I don't know if this fit's going to be here. And I don't care how great their clinical skills are. Most of the times people do not lose their jobs because of clinical skills. Sometimes it's stabbing in the back, talking about, complaining, all that kind of stuff. So we want to be engaged. So worker engagement, how do you get them engaged? Engaged are energetic, enthusiastic, absorbed by the work. Their relationships, they have relationships with fellow nurses, physicians, managers. Teamwork, we said, was an important piece. And that improves engagement, improves job satisfaction, improves retention. And we know that engaged nursing teams report better quality patient care. Colleagues, it's a no-brainer. It improves patient care. Wow, passion. Do you remember the passion of why you came into nursing? Why did you become a nurse? I can tell you why many of you became a nurse. I think one of my early roles was as a nursing faculty in the undergraduate baccalaureate program. We interviewed every sophomore student that wanted to go into the nursing program. You'd ask them, why would you like to be a nurse? I want to help people. I want to make a difference in the lives of people. I almost got sick and tired of hearing it. You know, what you long for is to say, that's a great reason to become a nurse. But sometimes you'd say, I wish I was able to say, well, I really want a job, yes, that I can work with people. I'm a people-oriented person. Also, it would be nice that I can travel anywhere in the world and work as a registered nurse. If I'm relocated for some reason, it's not that difficult to find a job. And you know, as nurses, we're always looking. Yes, there are times that there's layoffs and those kinds of things that occur. But for the most part, you know, when you graduate as a registered nurse, you are prepared as a general practitioner. Do you understand the variety that we have? Think of the variety of workplaces. You can work in a hospital. You can work in home care. You can work in correctional nursing, in prison systems. You can work long-term care. You can work schools. Where else? Clinical trials. Private patients. Doctor's office. Well, let's say a provider, primary care provider's office, because I also have a family nurse practitioner program. So I choose not just to use the term doctor or physician if I can insert primary care provider. So for primary care provider's office. Cruise ships. Colleagues, I taught CEO of a cruise ship one time. And it was an Alaskan cruise. Can you believe it? Movie theater sets. Stay away from the ones that you guys the new producer that I'm hearing on TV right now. Don't be working on his sets, nurses. But you guys understand, there's a nurse that works on the Tonight Show with Jimmy Fallon. I heard that one night, someone wanted to guest come on. They said, I want to thank the nurses here tonight for the wonderful care she's provided to everybody here. So nurses are working everywhere. Now, not only can you work anywhere, you can work with the heart. You can work with the lungs. You can work with where? Kidneys. Heck, you can work just the skin if you want to work just the skin. Okay? You can work with neonates. You can work with pediatrics. You can work with adults. Adolescents. You can work with adults. You can work with or you can go to the ER, you can work with whatever walks in the door. Right? Colleagues, we have variety. There should never be a time that you are just, you know, and with some slight retooling, we can retool. Right? So there's lots of variety. But we want to be passionate. We want to maintain our skills and competencies. What are you good at? Please know, what are you great at? What are your strongest skills? And also, what are the skills that you need to improve? I'm always looking, what do I need to be better at? We do goals each year. What can be done? Build on your experiences and your expertise. Please know that you bring all kinds of expertise with you. Invest in yourself. Now, sometimes some nurses think, well, I just need to do CE that my provider provides for me. No. You need to set aside $1,000, $1,500, $2,000. Colleagues, y'all make decent money. All right? You need to set aside some money for you to be a part of a professional organization, to attend some conferences. If your organization is paying for this, then that's wonderful. If you pay it for your own, then you recognize the need to invest in yourself. You need to spend some time, maybe 1 or 2 days, that you go to the beach or wherever your place is. It could be mountains, wherever the beach. Then every now and then you just kind of go there and just think and reflect. Where am I in my career? Where do I want to go next? Where do I want to be right now? That's part of a healthy career. Maintain a passion for people. One of the reasons I love, whenever I'm invited, I'm always ready to go. Because I know I'm going to be working with nurses. And nurses, colleagues, are people. Right? I was asked one time to do a presentation for a group of accountants. Colleagues, don't laugh. They're great people too. They're just not as expressive as you are. Okay? But I asked them, I said, so why do you want a presentation on nurse recruitment and teaching? They said, well, we do accounting for hospitals, and we need to understand that stuff. But colleagues, I will tell you, your eye contact from me right now was not what they gave. I've never worked so hard with a group. Probably got the best evaluations I've ever gotten. Because I probably was a real fool that day. But great people, but they're usually not people. You know, they enjoy the time with numbers. They're probably more introverts. Many of you, we have some introverted nurses, but a lot of you are extroverts. We can party till the morning comes, right? But you know I'm extrovert. I mean, you said you're nervous up here. I'm not nervous up here. Okay? So please know that nurses are people. You do understand, you do make a difference in people's lives. Do you know that? Let me tell you how I know. I'll ask you this. You're either at the mall, you're at the grocery store, you might be at a movie theater, I don't know, but you're somewhere in a public place. Someone walks up to you and they call you by your name. And they say, Ben, I just want you to know. And you're looking, when they do that, you're looking at them, you're thinking, oh my God, who is this person? That's what you don't say it, but you're thinking it. Okay? And they say, I want you to know how much I appreciate the care you provided for my significant other, for my family member, for me. How many of you have had that happen? Raise your hand if you can. Look in this room. Okay, if you've not had it happen to you, don't be surprised when it does. Okay? But what that means is that as nurses, we move from room to room, or in home care, we move from home to home. We're so busy focused on what the next issue is, what the patient need is, that sometimes we don't think and realize that we're making that kind of impact on your patient's hearts. It's forever. As long as they're alive, they don't forget your name. So please know, those of you that came in to make a difference in people, you're doing that. And it may not be a patient. It may be, if you're in academia, it may be a student. I've had students do the same thing. I look at them. I've been teaching for a long time, and I'm thinking, oh my God. I always try to be polite. And sometimes they say, well, you don't remember me, do you? Well, I won't say, well, no, I actually don't remember you. Of course, I would always try to tell them, tell me more about what year you were there and those kinds of things. It may be a colleague, a fellow nurse. I was doing a presentation. North Carolina has a great 100. They do a celebration each year. They select 100 of the best direct care nurses. And they asked me to do the presentation for that event. Must have been about a year ago. I think I probably was headed to the restroom out in the hall, and the nurse walked up to me. She says, "You're a dentist, aren't you?" I said, "Well, yes, I am." She says, "You may not remember me, but my name is Sue." I said, "You look so familiar, Sue." And she says, you directed an orientation program at Wilson Memorial Hospital 27 years ago, didn't you? I said, "I do remember working, directing an orientation at Wilson Memorial Hospital." She says, "I was one of your new grads that came in." She said, "I'll never forget how you made me feel as a new graduate." So, no, colleagues, you make a major difference. You may not realize it 27 years later. Yeah. So keep a passion for people is an important piece, and know that you're making a difference. I'll also tell you, don't wait to know till somebody tells you. Because each and every day, if you provide excellent patient care, and you're waiting for those patient satisfaction scores to tell you did a good job, or you're waiting for a patient to write you a card, or you're waiting for a patient to tell you thank you today, don't wait for that. I've had some days, I know, based on the resources that I had and the challenges that I had before me, I did good to get my patients turned. So you've got to know that for yourself as a nurse professional. So it's nice to know you're making a difference in people's lives, but don't just wait for that. Bring value to your workplace. Really look at how you bring value. How do you do that? One of the ways is looking at some of these initiatives down here. Be a problem solver. I can't tell you, one of the, in our system now with our online programs, that kind of stuff, I'm trying to help develop courses for online. And that's new for some of our faculty. And being able, I can see it in some of my administrators' faces when I say, look, here's the issue, but let me tell you how I'm going to address it. And just as soon as I say that, you can just see on their face. So colleagues, be a problem solver. You know, here's the issue, here's what I see going on, here's the suggestion I would say how we would do that. Now, you can be asking for approval, those kind of things, but you know, it's really nice if you know where you're going with those things. Focus on strategic initiatives. I mean, there's so many of them out there. Quality patient care, patient satisfaction, quality improvement, patient-centered care, developing healthy workplaces. All those are initiatives that are important for your workplace. If you want to demonstrate you're bringing value, choose one of them. I tell my new graduates now, choose one of these. Develop expertise in this. You'll be in demand for a long time. How do these processes work? How can you lead these committees that are looking into this? All of those are important issues in patient care. Colleagues, be willing to change. Don't get stuck. If you're staying the way everything was, then you're just in status quo. We know change is a part of a daily operation. I remember when it took forever to change anything in patient care services. Now, you can change on a dime. I will tell you, I think in education, we are not there yet. I can't tell you the number of committees it takes to change a sentence in a syllabus in my educational program. Okay? We're not there yet. Now, some of you other guys might be there, but we're not. And I will tell you what I think drove it in healthcare was when DRGs came in years ago. And when really it was all about the money. We're not going to pay for it. We can't make a change, that kind of stuff. That's not quite hit our head yet. But I think it will. Be willing to try new things. Imagine how that change is going to affect you so you can decrease your feelings of uncertainty. Think about how it's going to impact me. And then think about things in the past that you swore you would never. Everybody have smartphones now? Anybody still holding out on a smartphone? Got one. Okay, we'll bring you along. I was going to hold out forever. I'll tell you, I still have not gone. I have not moved to the electronic calendar yet. I still have my paper calendar. I know. But actually, one of the reasons it syncs with everything at work. I don't want everybody to know where I am all the time. But realize that think about change. We've always got to look at new technology. Remain positive, positive attitude. Under promise, over deliver. If there's not anything I can tell you better than that. You do understand, as nurses, we are pleasers. We like to please people. And I'll help you understand, if you haven't figured it out by now, you're not going to please everybody all the time. So one thing I've learned to do is under promise and over deliver. Okay, go into the patient's room and they say, can I get extra pillow? Many of you are going to say, well, of course you can. You go to the linen closet and guess what? Now you come back and there's mud on your face. Sorry, there were no pillows there. All right? Whereas all I had to do tell her the first time, sometimes that can be a challenge here. Sometimes that can be a challenge here, but I'll see what I can do. Okay? And of course, if you go, we'll call in and say, I'll give you a better example. Anybody have kids? Kid wants a bicycle for Christmas. You tell them, of course, I know we can get you a bicycle. Oh, it's got to be this specific one. The red, the pink one with the Barbie things and that kind of stuff. Can't find one anywhere. Okay, so you buy one close to it. Not the same, is it? All you had to do in the beginning was say, this has been a tough year. I don't know if we're going to be, I don't know if Santa Claus will be able to bring you a bicycle this year. We'll just have to see. Now you get up on Christmas morning, there's a bicycle, even if it's close to it. What are you going to do? Colleagues, under promise and over deliver. I've learned many times. People do this all the time with deadlines. If you need a deadline, set that deadline about a week later, and it really has to. You have a deadline, you have a drop dead deadline, and then you have a deadline. Somebody laughed. Is that the first time you've heard that one? Colleague, I'm glad I came to talk to you today. Okay? Yeah. Set it back. And then, if you get it there by your deadline, then guess what you've done? You've over-delivered. Right? I'll give you another example. In my classes, if any of you ever take one of my courses, if I can't decide whether to put that in as an assignment or take it out at the beginning of the semester, I'm putting it in. During the semester, if I see everything's going fine, guess what I can do? Oh, you know what? You guys are doing so well. Let's just take this last assignment away. You know who I am then? I'm the hero. Right? Colleagues, under promise, over deliver. And my colleagues want to know how I get such great ratings on Classroom. Under promise and over deliver. But you have to do it from the very beginning. Remind yourself of your past success. Sometimes when you look into a new challenge, know how you're addressing that. And know that you've been successful in the past. There's not probably been many things that you've not been good at, that you've not been successful at. Identify things for which you're thankful. I mentioned, I think it was Ben when I mentioned about driving up. And I mentioned to somebody, said, oh my, you drove 7 hours yesterday? It was a beautiful day. And actually now I much prefer driving than fly. Because, you know, I really enjoy those toll roads I came up here on. We only have one of those in North Carolina. It takes a picture of your license plate. I mean, you get to stop and talk to people along the way, right? I think every one of them told me to have a great day. Colleagues, now I'm not a Pollyanna. I'm not trying to look through the world through rose-colored glasses, but I will tell you, even when something, you might be surprised at what this cold's going to run, but these are some positives here. You know, once again, I told you I'm an extrovert. I like to talk to people, right? Identify thankful. Look at solutions. Be a problem solver. Assist others to develop a plan of action. Work on a personal goal that energizes you. I've had times in my career, sometimes at work, maybe I wasn't doing the most exciting, creative things, but maybe at home I'm doing something else. Maybe I'm doing a building project. I'm doing something that engages me. Find things that engage you. I just want to quickly cover this retention model. Parts of this are looking at leadership, parts are looking at meaningful work, and there's a retention focus. I'm going to cover this real quickly, but some of it we've already done. We said people are focused, autonomy, make decisions. People don't understand that you make decisions each and every day. And if you're a manager, they don't understand you're managing multi-million-dollar budgets. Young kids today still think nurses take orders from physicians, and that's about what we do. So you need to help them understand that, or maybe that physician's getting, maybe that physician didn't come in and save that person's life, but who was it that called that physician, picked up on the signs and symptoms that patient was going bad to let them know that you need to get down here. Or many times you told your buddy get in here, right? We talked about variety, value as a colleague, resources are important, opportunity to learn, feedback, understanding significant contributions, know what you bring to the workplace, championing change, shared vision of organizational direction, motivate and recognize contributions. Recognize your colleagues, but don't ever ask them to speak in public. When you recognize colleagues, if you do some kind of award, don't ever say, would you like to say a few words? Because many people would rather die than to speak in public. It's true. It's true. So you don't surprise them in that way. You know, recognize them and say, we thank you. Or if you do, ask them beforehand, would you like to say a few words? If they don't, say, no, that's all right. That's okay. Look at how you can develop others. Modeling behavior. Looking at recruitment, retention, those kinds of things are important as well. Saying thank you for a job well done. I've done presentations on just how to recognize colleagues is important. Reinforce desired behaviors. Create emphasis and focus on a healthy workplace. Self-esteem. Celebrate success. You guys have parties at work? You need to have a party at work. You need to celebrate when new people come in. Why do we celebrate when people leave, but we don't celebrate when people come? Well, you know then, but you need to start developing that relationship with that new person. Help them on board and get them in place. Develop camaraderie. Mentor, coach, and groom is an important piece. Here's what makes people happy. Appreciation, respect, trust, individual growth, good boss, compatible coworkers, and a sense of purpose. That's an important piece of who we are and what we do. Now, we also need to develop leader competencies. And this is the thing I want to share with you. When you lead this conference for the next few days, you're going to get a lot of different ideas over the next couple of days. And what you're going to do is want to choose some of those. whether you jot those down or whether you mentally say, this is something I'm going to take back to my organization. You have a choice on doing that. Having the leader competencies to put those in place will be helpful as well. How are you strategic about getting those changes put in place? Because sometimes, I've shared a lot of different ideas. I am an idea person. I've told people, I said, I have lots of ideas. It's my follow through that's heck sometimes. But part of that's emotional intelligence. It's developing, it's lifelong learning. It's implementing a vision and developing a vision. So let's just quickly look at those pieces. So once again, it's communication. It's interpersonal. It's all about relationships, colleagues. Empathy. Being realistic, have a realistic self-assessment. What are you good at? What do we need to be better at? And even if as you're looking at these, I hope you're saying, yep, I'm great at that. Oh, good at that one. Ooh, that openness one. That might be one I can work on. You know, openness, if I come to Catherine and I say, you know, we worked together for the last 2 weeks. Can you give me some suggestions on what can I do better on? What can I do better on? Those are important pieces. Now, some of you will say, just like approaching that person that's on the schedule. So that's not my job. But let me ask you this question. I've not had a chance to interact with all of you today, but if I did interact with you, and you noticed I had really bad breath, how many of you would tell me? 2 in the back, 3, 4. One says one's doing like this, she says I would tell them real quietly. Okay? How many of you, if I interacted with you today and you had really, really bad breath, you'd want me or a colleague to tell you? Colleague, I just want you to look around this room. Go on, raise your hands high. What that says is that you want to be told, but you don't want to tell anybody. Okay? Colleague, that's something you can work on. That's something we can work on. I was at work one day, and I don't remember why my collar was unbuttoned. I went a half a day, nobody at work told me my shirt was unbuttoned. You know, at lunchtime, somebody said, Sherrod, you need to button your shirt. I said, thank you. Thank you. I said, nobody told me that today. You know, I've had colleagues I work with, I said, you got a big old booger, right? Right up there. And I don't put it that way. Colleagues, we're nurses, right? You know, what I say is, you may want to step to the restroom. You got something right there you probably want to take care of. You know, I care about my colleagues like that. Now, that's not, when you tell them, you don't have to get in front of the whole world and say, Dennis, your breath stinks. That's not where you have to go. But you can say, Dennis, can I talk to you for just a minute? Man, I'm noticing breath might need a little work. You know? But whenever I do this with a group, I want you to understand, the majority of people want to know, but there's very few. Thank you, those in the back who are willing to tell. But very few are willing to step up and tell. So that's an area we can work on. Lifelong learning, it's motivation, it's curiosity. You're lifelong learners or you wouldn't be here. That's one of the reasons you're here. The drive, the initiative, the enthusiasm, the being adaptive, growing, developing, and learning. It's an important piece. And this developing vision of where you want to go. Where do you want to go? Where do you want the people in your organization to go? Tell stories about that. Ask some questions. Bring it up in some of your staff meetings. It's an important piece. Taking some risks. Being committed, being able to see the big picture, and being open to different solutions. All that's important. And then how do you implement a vision? Motivating others. You understand that you cannot motivate me.
Right.
Motivation is intrinsic, but I can set the scene for you. You know, hopefully look at ways that might help you become motivated. Maximum use of skills, solutions, commitment, optimism, celebrating victories, recognizing others. Colleagues, one of the things you want to do is give some thought to what we talked about today. Patient care, patient safety, minimum. Quality patient care, minimal. But choosing to improve our own personal health, choosing to go back to our workplace and are just like that bubble right there. We've talked about a lot of ideas. Have you heard some new ideas today? Those ideas are just like that bubble. If you don't choose to take an idea and put it in action, what happens to it? It becomes nothing. But what I want you to know is if you choose, you can take that idea and turn it into something real. Colleagues, it's been a pleasure this morning. I hope you have a wonderful conference.